Lip augmentation or lip enhancement can be done through a variety of procedures. The procedures most commonly used at the Aesthetic Institute of New York and New Jersey are injectable fillers. Okay. So here's our patient, Alexandra. Alexandra, why did you have your lips enhanced?
I always wanted just the poutier, kind of sensual look without looking too, fake. But, I figured, non-surgical would be the way to go for me.
Mm-hmm. And you had the Juvederm injection, and you're pleased with the results so far?
Very much so, yeah. It looks completely natural. It's obvious without being over, obvious. So, yeah.
Right. And you're here today for a little bit of a touch-up because we do it in increments, just so we don't get your lips to look like Angelina Jolie in the first day.
Yes.
Is that right?
Yeah.
Okay, great. And do you have any discomfort during the procedure?
It's, a little bit uncomfortable, but definitely bearable. And, it's so quick that it's not really a big deal. So.
And what about the swelling that you have or any bruising?
I've had no bruising at all. The day of the injections, there's really nothing. And the next morning, it's a little bit puffy. So the next morning is probably the worst for me. And then within, 24 hours, it's fine, so.
Great. So we're going to do another little injection here. And we're going to show you how that's done. Okay, go ahead, roll it. Okay, so Alexandra preferred not to have any local anesthesia. Sometimes we do a block where we do a little injection here and here because the nerve innervates the upper lip. And a little injection here, but sometimes those injections hurt more than the actual filler. So we're just going to start with a little bit of Juvederm. Just relax your lips. What we're going to do is a little tiny small pinprick here. And you're going to feel a little bit of pressure. You okay?
Mm-hmm.
Alright. And then we're going to do a little tiny pinprick here. A little bit of pressure. Okay, and just hold that. Stop it. Okay. So we're just going to give a little more into the center here. And this gives the pouty impression of the lip. And we're just going to give a little bit on the side. Typically the lips are larger towards the middle and they taper off to a kind of thinner lip on the side. Okay, I think that's good. I will massage it just a bit. Typically patients do not massage after. They put a little pressure on. You can see that the lips are nicely enhanced. They will swell up on the next day, but then they'll go down. You just hold a little pressure there. So we're done with the lip injection. We just did small quantities. And it's better to do small quantities in increments so we get the size that the patient prefers. So how was that, Alexandra? Not too bad?
Not bad at all. It's quick.
Okay, good. Thank you.
These are the before and after pictures of Alexandra after 2 microsessions of Juvederm. Typically, first-time lip augmentation patients will start out with small enhancements of the lip and come back over time to increase the size of the lip to their liking. First-time patients also like to use products such as Juvederm or Restylane that are not permanent. This will give them an idea of how their lips will look like if they use a permanent product such as silicone. In my patients, Juvederm lasts typically between 6 and 8 months and sometimes occasionally more. This is a patient that had Juvederm in her upper lip. As you can see, there's an asymmetry in the upper photograph. Her lower lip's a little bigger than her upper lip. The upper lip had Juvederm to match her lower lip. This is about a 6-month post-injection result. This is another patient that had a smaller upper lip, and she also had Juvederm of the upper lip, approximately 0.7 cc's, and this is an 8-month result from Juvederm injections. This patient started out with Juvederm injections. She was so pleased with them that she advanced to silicone injections. She had 2 sessions of silicone injections of the upper lip, and they've lasted her for longer than a year. She is very pleased with the results. This is another first-time patient that had Juvederm of the upper and lower lip, and as you can see, she has a nice enhancement of the upper and lower lip. They do not look overdone, and this is about a 3-month post-injection result. This patient had silicone injections of the upper and lower lip. She had 2 sessions. With silicone injections, they must be spaced 1 month apart. Patients may require 1, 2, or 3 sessions depending on the size of the lip they want. In this patient, this is about a 1-year post-injection result. This patient opted for silicone as well. She had 3 sessions of silicone injections. Her desire was to get her lips as pouty as possible. Again, silicone injections are spaced a month apart, and we use micro-droplet technique during each session as to not to avoid enlarging the lip too quickly. Every patient has different desires and the size of their lips. I hope you have enjoyed this educational video. In my practice, I use Juvederm, Restylane, and silicone for lip augmentation due to the high degree of reliability and the high satisfaction rate of our patients. Please visit my website at facechange.org for more information on lip augmentation. Thank you very much.